Hey guys, I'm going to continue on going through the forms. Another form that every surgery patient receives is this A to Z list of medications to avoid. This is not all-inclusive. We do ask you what you're taking. So we ask you at your consultation what you're taking, and then we ask you at your pre-op what you're taking. Please list all of your meds. If you take so many meds you want to bring us a list, that's fine. But the reason we ask you twice before you even show up to your surgery is because we need the opportunity to review your meds for your safety, to see if there's any special considerations that we need to take, like having you stop it, or sometimes we may need to run a lab or something like that. If you show up for your surgery and you are taking a medication that prevents us from proceeding with your surgery without taking some kind of precaution, they will cancel your surgery. And they will cancel it, and you will have to pay a fee to reschedule it because now we have an open spot. We've got an anesthesiologist we have to pay for, and nursing and all that. So it's very important that you tell us what you're taking, what you take occasionally, even if it's over the counter. The biggest thing that we're having issues with right now is prescription diet pills, like Phentermine. That's a big one. That's probably what our surgeries end up getting canceled for the most, because those types of meds, we need you to be off of it prior to your surgery, and that is so that we have better control of your blood pressure while you're asleep. So that's not something, that's not something we play around with. But there's a system now, a pharmacy system, where before doctors are able to send over, I'm trying to think of how to word this, before doctors are able to prescribe you controlled medications, they have to check this database to make sure that you don't already have these medications somewhere. This is a big thing because of the opioid epidemic. So when he writes you a prescription for your pain meds, he actually has to go into this database to look through all of your controlled medications and make sure that you don't have this somewhere else. This is something that the DEA is requiring us to do. This is not something that we're trying to be invasive into your privacy. This is something that the DEA now requires everybody to check this database. So when he checks the database, he sees your Phentermine. He sees it, and he can see when you filled it last. So unfortunately, this happens right before surgery because that's when he's checking to see that he can prescribe your pain meds. So a lot of people, don't think that you can sneak that in because we'll see it, and it's for your safety. Don't do it. It's for your safety. If your blood pressure drops and you're not responding to the epi to bring it back up, we don't have a lot of options to bring your blood pressure back up. Like, it's very serious, and there's a reason for it. So anything that you're taking, please tell us. Do not leave anything out, Bolt. Do not leave anything out. This is also the point that we're going to be looking to see if you're taking one of those weight loss, Ozempic, Mounjaro, which is fine. You can take those. But we need to know about it so that we can tell you to stop it the week beforehand. Because if you're taking it and we didn't have the opportunity to stop it and you come in for surgery, guess what? Got to reschedule you, got a fee. So A to Z, if you're taking a medication, go through this list, make sure it's not on here. A big thing is herbal supplements. People, think it's not a big deal to have those vitamins. Fish oil. Did you know fish oil can make you bleed? Yes, it can. So we've got to really check everything that you're taking. If it's something, I tell people all the time when they're like, what about biotin? What about this? What about that? Okay, if it's not on the list, that's fine, but why not? I mean, do you need your biotin 2 weeks before surgery? Like, are you going to be okay if you don't take it? If it were me, I would just stop it. Unless it was something that I needed, I would stop it. And then if it was something that I needed, I would ask if it was okay to take it. Again, smoking because, you know, nicotine is a drug. It goes into your system and it affects your bleeding and your healing. We know if you're smoking, people try and hide it, but we know. So that's it. Check through, see if it's on here, but our backup, in case you can't read or in case this is missing something, is we want you to list it. That way we can check, we know what's on here. And then again, it has on here, if you don't tell us, if we have to reschedule you, there's a fee. Okay, so that's it. That's the medications to avoid.